So I'm going to be going through the admission process for a canine neuter that we have coming in. His name is Scout. Scout is a 17-month-old intact Labrador Retriever mix. He's been a healthy guy, only been in for wellness. Now he's an adult, and so they're gonna neuter him. We start with our drop-off form. This just goes through basic history, make sure there's no other issues going on at home, they're not on any medications or have any issues with any medications that we're not aware of. Make sure that they haven't been fed before surgery. And then we also have estimates for every procedure so that there's no surprises when they pick up. We always offer blood work, a mini chem and a full CBC. It's generally optional in healthy pets, but we do require it for some procedures. Since Scout is over a year, his neuter is going to be considered a mature neuter, so we do charge an additional fee for that. We are mostly a paperless practice, but this is his full medical history, all of the doctor's notes and everything from all of his visits, which has just been for wellness mainly. We also have our release form. So this just goes over your pet is having an anesthetized procedure. They are going to be under general anesthesia. Make sure that the owners understand the costs of the procedure, risks associated. Also, they have to initial that they are accepting or declining pre-anesthetic blood work. We always recommend it just because it can change the anesthetic protocol if there are any underlying issues, particularly with liver or kidney function. They may metabolize medications differently. So we make sure that we have their signature that they either are accepting it or declining it, with knowing the risks of declining it. If we were to do in-house blood work, it's again paperless, but we can print it out if we need to. So we have CBC and chemistry. This is for another patient, so this is not for Scout. And then we have, we don't have cage cards. We hang their chart on their cage, but we also have identification collars that all of our boarders and hospitalized patients wear. Has the clinic name and phone number as well as the patient's name. And then we have our anesthesia form. So for all of our pre-medications, any other procedures we're doing in addition to the main surgery, as well as our monitoring form here, any surgical supplies that we use during the procedure can be documented at the bottom, as well as what type of surgical packs and anything that they have for their recovery. So I'm going to review our general discharge instructions. This dog, Senna, had a toe amputation done today. So it's just basic things to look out for after anesthesia. So any nausea, inappetence for greater than 48 hours, not wanting to drink for 24 hours or more, vomiting, diarrhea, any issues with the incision or excessive drainage. We do tell people that their pets are going to be fairly drowsy for a minimum the rest of the day, but if they're not kind of bouncing back to normal the following day, then to let us know. As far as feeding, we generally recommend feeding about half of their normal sized dinner in the evening with some water, and if they do all right with that, no vomiting, no issues, then the next day they can resume normal feeding. We also want to make sure that pets are quiet for the evening after their procedure. We want them very quiet. We don't want them hurting themselves while they're drowsy and kind of out of it. We do want them to be leash walked, particularly for abdominal surgeries, 14 days of leash walks. Senna is going to be leash walked as well for at least 14 days. We also have instructions for keeping her bandage clean and dry. So we generally send patients home with an IV bag that we can make a little boot to keep the bandage dry. If it's raining or anything, keep it clean when they're walking on it. She also will need to come back in 2 to 3 days for a bandage change, but we have notes that if it becomes dirty at home, then they should remove it and bring her in earlier. We also have medication instructions. So Senna is going home with tramadol and carprofen. So for the tramadol, she's going to start this medication tonight. Tramadol can cause a little bit of sedation, occasionally some stomach upset. It's a pain medication. And then the carprofen is her anti-inflammatory, and it can cause pretty severe GI issues, vomiting, diarrhea, can cause ulceration with extended use. And Senna is also on prednisone currently, and she's finishing a course of prednisone. So we're not having her start the carprofen for 3 days because she's finishing her prednisone, and that can kind of wash out of her system. So there won't be any additional risk of GI upset due to the interaction between those two drugs. And Senna's sutures are dissolvable, so she won't need to come back for suture removal. She'll be back for bandage changes in the meantime. As long as everything is healing okay, then we shouldn't need to see her. She will have an e-collar to make sure that she's not licking or chewing on her bandage, because that's a kind of irritating area. We also use bitter apple spray, and we'll recommend that to the client as well, so that the bandage will taste bad if she does get a hold of it, and hopefully that will deter some licking, biting, and chewing on the bandage. Alright, so for a jugular blood draw, you're going to want to hold the patient's head up to expose their neck. If they have a collar on, you can hold that up with your pinky fingers, but make sure your fingers are out of the way so the jar has access to their whole neck. And for a cephalic, you're going to hold it behind the elbow to keep the arm extended, and then just roll the vein outward with pressure, which exposes the cephalic vein right there. And for lateral saphenous, the patient can be either laying down or standing. Okay, I'm ready. All right, and if they're in lateral recumbency, then you can just hold off above the stifle, and you want to roll forwards, and then that exposes the vein right there. All right, so to put a patient into a kennel, you just want to open the door and lead them in, and then block the entrance with your body. Make sure that they can't slip out, and then just pull the slip lead over their head and close the door. And then to take them back out, sit. Again, you want to block so that they can't escape, and then get your leash on them before you let them out of the kennel, so you still have control. So to remove a cat from the kennel, you want to open the kennel. And you want to make sure you're blocking the opening of the kennel so that they can't dart out. And then I'm going to kind of tuck her under my arm like a football and hold on to her scruff. And then if we need to do any treatments, we'll just have her right here on the table when she's ready. And then when she's done, same thing, I'm just going to scoop her up under my arm, hold on to her scruff, and place her back in the kennel. And then again, making sure that she can't dart out before I choose to close it. So when you're applying a cloth muzzle, you want to do it quickly so that they don't have time to react, but you also want to be gentle. So we're just gonna scoot her head down and then put it right behind her ears so it's tight. Alright, so to fit a dog for an e-collar after they've had a procedure or if they have a wound and they have stitches and you don't want them to be able to lick or chew at them. So you want to select a size. That will go to the end of their muzzle so they can't get past it. And you want to tighten it so you can still get at least 2 fingers in the neck, but they can't slide it over their ears. So that's good. And then if we were sizing this to him, we would pull this off and stick the Velcro right there so it would be custom sized for him. So I'm going to do a physical exam on Buster here. He's a little bit nervous, but he's bright and alert. He's a pretty healthy body condition. Maybe a 5 out of 9. So I'm going to listen to his heart. So he has a normal heart rate, normal rhythm, no murmurs or arrhythmias. His heart rate is around 110. So you can either count for 6 seconds and multiply by 10, or count for 15 seconds and multiply by 4. I also listen to his lungs, so I'm listening for crackling or wheezing, fluid, anything that would indicate some sort of respiratory distress. But I didn't hear anything. All his lung sounds were clear. And then we're also going to take his temperature. Sorry, Buster. That's 100s, it's normal. Alright, just peeking at his ears. There's no discharge or anything, no redness or irritation. It's hard to count his respiration with all the shaking, but it's around 30, which is normal. Look at his gum colors, pink. It's a healthy CRT of 2. Has some tartar on his teeth, but nothing too major, no gingivitis or gingival hyperplasia. His eyes are bright and clear. I don't feel any masses or lumps on the skin. Abdomen is tense, but not feeling any internal masses. Nothing concerning there. He is intact, so I'm gonna make sure to palpate both testicles. They both feel normal. So I would give Buster an ASA score of 1.
Go.
Alright, so I'm going to perform an exam on this feline. So I'm going to start by listening to her heart and her lungs. And her heart rate and rhythm sounds normal. Her heart rate is about 180 and her respiration is 30. And I didn't hear any wheezing or crackles or anything in her lungs to suggest that there's a problem. Right. And her eyes are bright and clear. Her ears look healthy. Okay. And she doesn't have a lot of tartar or gingivitis or anything. Her gums are a healthy pink color. Her CRT is normal. And I'm just gonna feel, I don't feel any masses or anything on her skin. And her abdomen is soft, feels normal. I'm gonna go ahead and take her temperature. Normal temperature of 101.4. So if she were having a procedure, I would assign her an ASA grade of 1.
Oh, that little mate lag. Oh, good job, Snorts. Now, wait up. Dad's good girl. Oh, good job.
Alright. So do a lateral saphenous blood draw.
Be a good boy. Be a good boy, Buster.
Okay.
Good boy.
Okay.
What's the password for this computer?
A medial saphenous blood draw. Alright, and I'm gonna hold pressure and hold off. So the basic minimum required databases for pre-anesthetic lab work would be a PCV, total solids, blood glucose, blood urea, nitrogen, and alanine transaminase. So those are going to give you just a basic idea of kind of hydration status, liver function, that kind of thing. If any of those values were abnormal, then you would want to run a larger chemistry panel. Our pre-anesthetic chemistry panel has blood urea, nitrogen, creatinine, glucose, total protein, alanine transaminase, and alkaline phosphatase. So that's going to give you liver, kidney function, and then glucose can give you an idea of metabolism and nutrition status. We also have a just basic CBC, which does give you a platelet count, hematocrit, so there's you have your PCV there, as well as white cell count and differential. So that would tell you if there was an underlying infection or something, and also what types of white cells they're seeing in the sample. If any of that was abnormal, We would run our larger chemistry panel, which has all the same things as the pre-anesthetic chemistry, plus some enzyme function and pancreatic enzyme levels, as well as plasma proteins. We also, depending on what the procedure was for, if it was an abdominal procedure, anything felt abnormal, you might want to recommend radiographs just to get an idea of what's going on internally before you get in there in surgery. If the patient had a newfound heart murmur or something like that, you may recommend an EKG to check for rate and rhythm, arrhythmias, that kind of thing. Also might recommend radiographs in that case to look at their heart shape and size, see what their lungs are looking like. So our surgery is, for Senna, it's going to be a toe amputation. So our pre-medication is going to be hydromorphone with a touch of acepromazine. So the hydro is going to give us sedation plus 4 to 6 hours of pain control, which should carry her through surgery and into the beginnings of her recovery. And then we'll follow that with injectable buprenorphine during her recovery, so that will give her another 8 hours of pain relief before she gets home and can switch to oral medications. The acepromazine is just going to help a little bit with the sedation prior to induction, and then we will use propofol to induce anesthesia and isoflurane to maintain her during surgery. Alright, so we're going to record our buprenorphine that we used for Ninja's Dental. So the date is 10/29/19, and it was just given at 3:15. And we're going to record the owner's name, pet's name, and he is a feline. The doctor's initials are VB, and gave 0.2, so the balance in the bottle is going to be 48.6 cc's, and the technician that gave the injections initials are AM. So this is our anesthesia machine. We use sevoflurane. In this machine, we also have another machine that's exactly the same, but has the vaporizer for isoflurane only. So this is the vaporizer unit, converts the sevoflurane into the gas inhalant. And you just fill right here in this reservoir. And there's a window over here where you can monitor how full the gas is, and if you need to add more. Generally, maintenance for sevo is around 3 to 4, so it's a little bit higher than we run isoflurane. This is my oxygen flow meter, so you can monitor my oxygen rate. The manometer here keeps track of the pressure. You never want that pressure to exceed 20 when you're giving manual breaths or anything like that. This is my pop-off valve. You want to make sure that's always open anytime you are actually using this on a patient, because if it's closed, then the animal can't exhale and it can cause damage to their lungs. This goes to my active scavenging system, which we have. This runs out of the building. Then I have my Sodasorb canister, which absorbs the CO2, and my reservoir bag here. And then our tubes, we have the inspiration and expiration tube that connected by a Y piece here at the end. And that is our basic anesthesia machine. So for very fractious animals, or sometimes we also see some wildlife. We're a triage center for the wildlife center here. So we will sometimes use our induction chamber for wildlife. So I just would remove my Y piece and attach both of my inspiration and expiration tubes to the chamber, and then it seals. We also have a divider if it's a really small animal, so then we would only be using this part of the chamber. We also have various sizes of masks. So the masks just attach right to the Y piece here, just like a normal endotracheal tube. And then we also have our non-rebreather here. So for very small animals, we would use this. And I'm just going to detach this line here. So it hooks straight to the vaporizer. And this tube would attach to our scavenger unit down here. And then this just attaches right to the endotracheal tube into the patient, and then we would be using this as the reservoir bag rather than this. So this is where we keep our oxygen tanks. The larger tanks have these tags so we can mark which one we're using, would be the part full. And then when it's empty, we rip off the part full tag so people know not to use that one. We always have 2 tanks. And then we also keep smaller tanks for our oxygen cage. And we always try and have 3 or 4 of these, and they're labeled the same way with the tag. So this one is empty, but we have 3 full ones behind it. So to leak test my anesthesia machine, first thing I'm going to do is shut off my pop-off valve. And then I'm just going to plug the end of my Y piece here and fill my reservoir bag with the O2 flush. And then just looking at my manometer, I want the pressure to remain even, so it's staying right at about 27, and so that means that nothing's leaking. If the pressure were to slowly drop like that, that would indicate that there was a small leak somewhere, so that I would want to check all my tubes and my reservoir bag, make sure there's no holes or cracks in anything, make sure that everything is tight. And then you always want to make sure you reopen the pop-off valve so that it's ready for the next patient. I just have my esophageal stethoscope with some lube on it. And this one we have set up with stethoscope head so we can listen to it. But you also can plug it into your monitor. So I'm just gonna slide this towards the back of her throat, and it should go into her esophagus since the ET tube is occupying her trachea. And then you can listen. So you just want to listen to make sure that the positioning is correct, which it is, so I can hear her heart beating through that. Gastric intubation is generally used in bloating animals to relieve gastric distension if they have extra gas or fluid in their stomach. So then this is inserted the same way as the esophageal stethoscope, just goes further into their stomach. And I have my ECG leads. We use the alligator type of clips, so they're all placed on her left and right forelegs, and then her left hind leg. And we use alcohol to make sure that they're getting good contact. And my ECG's reading here in a normal sinus rhythm. And that also calculates her heart rate. And then we have our pulse ox, which you can use on her tongue. But you can also use ears or toes, anywhere that doesn't have a lot of hair, where you can get good contact. And we use a blood pressure cuff for non-invasive blood pressure, and I can manually check blood pressure here. And you can see the pulse ox is now reading her heart rate and her oxygenation from her tongue. And we have a blood pressure reading, which is in the normal range. We're also using a thermometer to check her temperature every 10 to 15 minutes. So that's not directly on the monitor, but we use a thermometer. And then I have a respiratory monitor that also measures CO2. And that displays right here. So we have her respirations per minute and CO2. And everything is within normal limits for her. So this is Dr. Courtney Jagger, and she's going to be helping me with my anesthesia videos this semester. All right, Jojo. Ready? So I'm going to do 3 scrubs over my catheter insertion site. So I'm going to start with, this is dilute chlorhexidine, and then follow with alcohol swab and a circular pattern working my way out. And for my last scrub, I'm just going to go right over my insertion site. And I'm just going to lay my thumb next to the vein without touching it. Right, and I have a flash on my hub, so I'm going to advance just the catheter. And I'm just going to flush it to make sure it's patent. All right. So we're doing a lateral saphenous catheter. So I'm going to shave around the vein. And I'm going to do 3 scrubs with dilute chlorhexidine first, followed by alcohol.
Recording.
I'm just going to flush with some saline to make sure that it's still pink. And I'm just going to do a light wrap with some vet wrap. Okay, so we're giving ampicillin sub-Q, so I'm just going to pinch the skin.
Hold on.
And then draw back to make sure I'm not getting any blood. I'm going to give antecedent IM. So I'm just going to isolate the muscle back here. And then draw back to make sure I'm not getting any blood. And inject.
Good girl medicine.
So we're giving dextromethorphan and Torb IV. So I'm just going to feel my cephalic vein and then use my thumb to stabilize it. Okay, pull it up.
Oh, good girl. Good girl.
So I'm going to induce and intubate. Mr. Jojo and Dr. Jagger is supervising. So we're using propofol.
He has had buprenorphine and dexdomitor as pre-medications.
Alright, and I'm using a 7.5 because of his size. So I'm using my tube to pull down his epiglottis and sliding the tube right between his vocal folds. And that tube was a fairly snug fit, so I'm just gonna inflate the cuff a little bit and check for leaks. So I'm gonna give manual breaths and see if I can hear air slipping around the tube. I don't hear anything.
You have good thoracic movement.
I'm gonna lube his eyes and then prep him for his neuter. And Dr. Jagger is going to use a scrotal incision, so I'm not going to shave his actual scrotum just to avoid irritation. Vacuum the excess hair. And I'm going to do my first scrub, starting where the incision will be, working my way out without going over the same area more than once. And that's dilute chlorhexidine again, followed by alcohol. I'm going to do a minimum of 3 scrubs total and make sure that my gauze is coming off clean, which it is not yet. And I'm going to do my last scrub just over the incision. Okay. You can cut off from it. Do you need Anesthesia? And we're just going to express her bladder. So I'm palpating for her bladder, and she has a very small bladder, so you can see there's a little bit dripping out, but her bladder is not full enough to be in the way if she were having an abdominal procedure. So we're going to move him into surgery, and this is the surgical field that's already been pre-scrubbed, so we're just going to make sure that we're not touching that. And he is having a cystotomy, so we're going to be positioning him in dorsal recumbency. So we have Jojo positioned for surgery, and I'm gonna do my final scrub. So the same technique, and again with the dilute chlorhexidine and alcohol. And then last scrub just over my incision site. And I have him hooked up to my monitors, heart rate, which since he was just induced, it's still pretty low from the dextrometer. So we have him on very low gas right now. His respiration's 10, which is normal. Pulse ox is reading at 97, which is also normal. And we're getting a good blood pressure reading on him. The temperature probe is not accurate. We use an actual thermometer. So then this is my monitoring form. So it's now 10:45. His heart rate is 46, respiration 8, pulse ox is 97. Check his CRT, which is less than 2. Mucous membranes are pink. His blood pressure is 98/59 with a mean of 76. He's on 1 for ISO, and his fluid rate is going to be 60. And we use a 7.5 tube. And this is all the information regarding his pre-medications and other medications that he had prior to the procedure and that he will be getting during the procedure. And then we just keep track of sutures that we use, any supplies. We're going to be using a major surgery pack. And then after the procedure, when he's extubated, how his recovery goes, and then he'll get an e-collar just to keep him from licking his incision. Okay. So to perform CPR on a small patient, if this were my actual patient size, I would encircle their ventral chest with my hand and use my hand to perform compressions. And you want to use your whole hand, not just fingertips. And I would make sure I'm compressing the chest about 30 to 50% and roughly 120 beats per minute. If it were a larger patient, I would put both of my hands on the side of their chest and same 30 to 50% compression and about 100 beats per minute. So another tool we use during resuscitation is an ambu bag. So it has a connection right here for the endotracheal tube, and then on the other end you can attach your oxygen hose, and then just attach this end directly to our anesthesia machine. So we can have a flow of pure oxygen to our patient, and then you just give manual breaths right into the endotracheal tube. So I'm going to start with cleaning up underneath my fingernails. And then I'm going to start scrubbing on the outside of my index finger, and I'm going to scrub each side of my fingers 10 times. And then go around and scrub all 4 sides of my fingers. And making sure I get in between my fingers. Tips of my fingers. scrub my palm 10 times. And my thumb, same as the rest of my fingers. And back of my hand 10 times. And then the 4 sides of my arm. And then the other hand, scrub the tips of my fingers. And then my fingers each side the same as the other hand. Drip excess off of my elbows. clamps, then all our forceps, needle drivers, and then we have thumb forceps and scalpel handle. And we always have 40 gauze sponges in each pack. Do you want to pour my fluids? Alright, and to put my scalpel blade on the handle, I'm just going to line it up with the opening on the blade, and then it snaps into the handle. So now that's ready for the doctor.
Scalpel, please. And the forceps. You could hand me the needle holder and the forceps, please. Thank you.
So the duties of a sterile technician during a procedure are to assist the surgeon with anything that they might need, mainly keeping their instrument tray organized, passing them instruments as they need them, moistening tissue or blotting blood away from the surgical field. And you want to make sure that you're not locking your knees. You want to make sure that you're shifting your weight so that you don't pass out in surgery, so you can be there. You also want to make sure you're staying out of the surgeon's way, so you don't contaminate them or yourself. If you are contaminated, there are a couple things you can do. You can just switch out your gloves if it's just your gloves that are contaminated with the help of another sterile individual. They can do open gloving where they hold your gloves open and you can put your hand in. If your whole gown is contaminated, then a circulating nurse can help remove your gown, and you can re-gown and glove with a clean gown and gloves. unless you are actually contaminated, you don't need to re-scrub if it's just your gown that's contaminated. If you are contaminated deeper than that, then you can re-scrub before you come back into the procedure. So to make sure you don't break sterility during a procedure, you want to keep your hands always above your waist or above the table height, and you don't want to touch anything that's not within the sterile field or on your sterile instrument table. If you do drop an instrument, don't pick it up. The circulating nurse can pick up the dropped instrument, and if it's something that we need for the rest of the procedure, they can do a flash sterilization, which is just putting the instrument straight into the autoclave and running a shorter cycle in the autoclave, and then bringing it back into the procedure. Or if we have spares of most of our loose instruments that are individually wrapped and sterilized, so if we were to drop something, generally the circulating nurse could just get us one of the instruments from the loose instrument packaging, and we would have a sterile replacement.
I'm Courtney Jagger, doctor here at On Trails Veterinary Center, and I just want to confirm that Melanie Kennedy has participated and helped in a number of canine and feline spay and neuter procedures.
So this is generally what the OR looks like after surgery. So there's several steps to cleaning up. First thing, I'm going to turn our heated table off and detach my needles. And any leftover trash is just going to go into our kick bucket here. And we have a separate laundry basket for all of our surgical laundry. So we have our drapes and gowns. And I'm just making sure there's no tape stuck to the outside. And all the tables, I'm going to write down a disinfectant spray. The edges of the table. And our doctors are all pretty good about cleaning their sharps out, but you always want to check, make sure there's no needles or scalpel blades left. So we're going to throw away the trash. And then take my dirty instruments. And these are gonna soak in, this is instrument cleaner and distilled water. So just to break down some of the blood that might be left on some of the instruments. And then the towel and drapes from that will go in with my surgical laundry. just gonna wrap this cord. And I'm gonna use alcohol to wipe down all of the lines. We have our respiratory monitor and CO2. So I make sure everything's untangled. And then that will get wrapped up as well. And my pulse ox. And lastly is going to be my ECG leads. And make sure I'm wiping them down individually so all of the leads are clean and untangled. And make sure there's no blood or hair or anything in our alligator clips. Clean them, I'm going to clip them to this tongue depressor, help keep them untangled while they're stored between use. And this will get wrapped up as well. Tie downs on the table. And we're going to pull our mats out so we can clean these. I'm just using the disinfectant again. Make sure I'm getting under the edges. floor. And I'm gonna remove any movable pieces of equipment, and then mop the floor with bleach water. So all of our movable equipment is just outside the OR, and I'm gonna use our designated surgery mop and bucket with bleach. And we only use this mop head and bucket for cleaning the surgical suite. Make sure any blood spots come up, and we'll get under the table so that all the surfaces are being mopped. And then we have a clean OR. That's about good. So I'm going to clean my soaked instruments just with this soft bristled brush. Make sure I'm getting all the hinges and the locks. And everything's gonna go in the ultrasonic cleaner. And that's gonna knock out any additional debris that might be stuck anywhere. It'll shake everything loose and lubricate the instruments. And you always want to make sure you're cleaning all of the instruments, because you don't know what's been touched or what was used but doesn't look dirty. And you want to scrub between all the teeth on your forceps to make sure nothing's stuck in there. And you want to make sure everything is submerged in the ultrasonic cleaner, and then this is going to run for 10 minutes. So I have all my clean and dry instruments, and I'm going to wrap my pack. So we start with a base of 40 gauze sponges. And I'm going to lay my forceps and scalpel handle right behind them. And then just kind of stack my instruments according to size. And then we lay our towel clamps right across the top so that you can easily grab them right when you open the pack. And I'm gonna put my sterilization indicator, then my pack, and the towel. And then we always put a towel on the top of our pack. And I'm gonna start with the edge closest to me and fold it up. And just accordion fold the slack that's left over. And then I'm gonna fold the sides and keep everything tight. And just fold back the slack. And then for the final side, I'm gonna fold it up and tuck all the excess into the pocket up at the top here. And then I'm just gonna do the same thing with the outer layer. And I'm gonna leave a tab out so it's easy to open. And then I'm gonna tape it with our indicator tape. And then label it with the type of pack. So this is a major pack. And it's our green major pack, so I'm gonna put the color on it as well. The date, which today is November 8th, 2019, and my initials, MK. And I'm gonna wrap a gown, so I'm gonna put the outer side facing up. Make sure the sleeves are flat and unrolled, and the cuffs are all laid out. And I'm gonna fold this outer edge to the middle and fold the other edge into the middle as well. And then I'm gonna take the whole gown and fold it in half. And then accordion fold this. And then I want to make sure that my ties are easily accessible right on the top when the doctor opens it. I'm going to lay out my 2 wraps. Place my gown with the towel on top and sterilization indicator. And then same as the surgical pack, fold this edge away from me and fold the excess. And make sure everything's tight. And same thing with the outer wrap. And again, leaving a tab out so it's easy to open. laceration indicator tape. And this was a medium gown, so we're gonna label it medium gown with towel. And today is November 8th, 2019. And then I'll just put my initials, MK, so they know who wrapped it. So now I'm gonna sterilize the packs that I wrapped. In our autoclave, you can generally fit one major pack and a gown in at the same time. So I'm just gonna slide the pack all the way to the back and then put the gown in. And I'm not stacking them. You don't want to pack anything in here too tightly because you want the steam to be able to get around the entire pack, because it's the steam that's going to sterilize the instruments. And then turn the autoclave on, and ours fills with distilled water here at the bottom. So once it gets to this little ridge here, then it's ready to sterilize. So I'm gonna close it, and then switch this to sterilize. And you want it to be really tight, but not so tight that you can't open it when it's done. And we generally set the timer for about 25 minutes to give it some time to build up pressure, because you want it to be in the ideal pressure between 15 and about 27 psi for 15 minutes. And then you also want the temperature to be around 250 to 270, so that's all on this dial here. And then once it's done, we'll switch this to exhaust, and ours will exhaust on its own. If you aren't here when the timer goes off, it just takes a little bit longer, so we can manually exhaust it in 25 minutes. And then we want to give everything time to air out and cool off, so you don't burn yourself trying to take things out before they're ready. So as far as autoclave maintenance, once a month, we take this tube, hook it up right here to this outlet, and we drain all of the distilled water out of the machine. Then we run one cycle with this autoclave cleaner. So this is diluted with distilled water. We run a cycle with that, and then drain that as well and refill it with distilled water. And then we also take the trays out and use a damp cloth to clean out the inside, clean the doors, clean the top, make sure that there's nothing in the way, nothing's rusty, nothing's broken, everything's functioning appropriately. So my packs are now sterilized, and I can tell because my indicator tape now has black stripes on it. And then when we open them in surgery, we'll be able to tell based on the sterilizer strip that's inside the pack that the inside reached the appropriate conditions as well. Alright, so Copper impaled himself on a stick, so he had several drains and lacerations, so we're going to remove his staples and sutures today. So on this laceration, it's clean and dry. If there were any moisture or gapping between the staples, then we would probably leave them in for a little longer and clean it to make sure it's healed, but this looks like it's healed nicely.
Oh, so taste. Don't be
buddy.
crying. Good boy.
Can you look at me?
Good boy.
He's
No,
lifted
no,
his
no,
lip.
no. That's to be brave and strong.
Alright, you can put a muzzle on him.
Yes, let's put a party hat. Okay.
Alright, so now we have Mr. Copper muzzled. Let's keep him honest, and we're gonna get the rest of these staples out. And that looks good. And then we'll get sutures from this laceration on his side. So I'm just gonna use my suture scissors and hook under the knot here. And pull it out. Alright, and again, that's clean and nicely healed there.
Good boy.